give a feedback to my colleagues on what you have done in this research. I've also informed the lead author, and probably he may join at any point in time. So we're expecting your feedback at the end of the presentation. So by way of introduction, we're aware that Nigeria has one of the alarming maternal mortality rates worldwide, more than 800 deaths per 100,000 live births. And then we also know that having a baby in a healthcare setting, tends to have more safety and better outcome for the women. And despite this, we know that almost 40% of women deliver outside the hospital setting. And some of the reasons that these women advance for not delivering within the hospital setting includes the healthcare system itself and their perception of the care that they receive within the healthcare system. And of course, their belief system and that of the community. And we're also very much aware that women that have a positive birth experience are more likely to return, and usually they have better bonding with their babies. And we came up with at least 2 research questions, which is how satisfied really are our mothers who have received care within our setting, and then are they likely to return for their future delivery? So based on our research questions, we aimed in this study to assess the satisfaction of mothers and their intention to utilize delivery services in future in our facility, that is Federal Teaching Hospital Gombe. And we also aim to make recommendations based on our findings that will guide our policies towards promoting maternal satisfaction and influencing or in promoting their future use of the facility. The study design, basically, it's a cross-sectional study. We looked at women that have delivered between March to August 2022, who were yet to be discharged after delivery. That is, who are in the postnatal ward. Either they've had vaginal delivery or cesarean section, but were yet to be discharged. And then we included women who were mentally stable, who didn't have any complications or who didn't have any serious adverse events that will make their management to be complicated. We also included women that gave consent to participate in the study. Those who were severely ill and mentally unstable or refused consent were excluded from the study. Now, our sample size was 250, which we deduced using the Fisher's formula for proportion studies. And we used a simple, convenient non-probability sample technique. Our data collection tool was actually a pre-tested interviewer, semi-structured administered questionnaire. And there were 4 domains that we looked at, which were the biodata.
You understand? So
okay, thank you. All right, thank you. So the questionnaire had a section for biodata, obstetric variables, maternal satisfaction, and also facial utilization. The satisfaction was further divided into 4 parts. And this has to do with the facility. That is what whether the participants were satisfied with the facility or not, and also the interpersonal relationship with health workers, and then the information that they were provided with during the course of their care, and then the technical aspect of their care, such as monitoring, assessment of the fetal height, and other variables. And all these were assessed using a 5-point Likert scale, which ranged from very dissatisfied to satisfied. The higher score indicated satisfaction, while the lower score indicated dissatisfaction. Neither satisfied nor dissatisfied was allocated number 3. And our dependent variable was mother satisfaction and visual utilization, while independent variable variables. Now, the data was entered into SPSS version 25 for analysis, and we did descriptive and inferential statistics. Ethical clearance was obtained from the ethics committee of the hospital. Now, our results show that overall satisfaction with care was well documented, and it was up to 84.4%. But if you look at the 4 domains, like I mentioned earlier, we looked at the facility itself, how clients were satisfied with the facility, and we realized that 92.8% were satisfied with the facility. And this satisfaction of the facility has 6 subdomains. First, we have the cleanliness of the facility, where we have up to 33.2% were very satisfied with the cleanliness of the facility. And the cleanliness of the toilets, up to 32.0% were satisfied with the cleanliness of the toilet. Up to 26.4% were satisfied with the promptness of services. And then with regard to availability of necessary medicine and supplies, 37.2% were very satisfied, while 48.8% were satisfied. Then what they think about the facility's number of doctors and nurses that attended to them, up to 45.6% actually was very satisfied with the number of doctors that attended to their care. And then with regard to overall cost of treatment being affordable, up to 45.2% were very satisfied about this. So these are the 6 domains that are under satisfaction with the facility. While under interpersonal relationship, we have 8 domains. The first one is I was warmly welcomed into admission. We had 31.2% of the patients were very satisfied with this. Then proper orientation and privacy, 34.4% and 38.4% respectively were very satisfied with this. Then with regard to emotional and psychological support throughout their stay in the hospital, 34.4% of the patients were very satisfied with this. And then when we look at treatment with dignity and respect, 38.8% of the women was very satisfied with the care they received. And then politeness and helpfulness, and the fact that caregivers explained treatment and procedures to the patient, up to 42.8% and 41.6% of the patients, respectively, were very satisfied with the service. And then finally, under the interpersonal relationship is patient being involved in decision making, and up to 40.4% were very satisfied that they were involved in decision making while in the hospital. Then when we look at the technical aspect of the care, overall, we have 82.8% being satisfied. And under technical aspect of the care, we have 9 subsections which are provided with pain relief, patients being provided with pain relief, then the monitoring of fetal heart rate and monitoring of maternal matter signs, then the monitoring of the labor itself, and being assisted in perinatal hygiene, being assisted in breastfeeding, being assisted in perinatal care and other wounds, and then assisted in early ambulation, and also being assisted into a comfortable position. These are all the aspects of the technical aspect of the care that we assessed, and up to 82.8% of the respondents felt satisfied with the service. Then finally, with regard to the information provided, and this includes information about how they will be examined, information about diet, information about the newborn, information about breastfeeding, hygiene, about postnatal care, the baby's care and immunization, and information about danger signs for the mother and baby during the postnatal period. And then the patients will also ask whether they were given much information. And overall, I have 74.4% of patients felt satisfied with the service. Now, this just shows what I've just finished discussing about all the 4 domains of satisfaction that we assessed. And this slide shows the overall satisfaction of delivery services. We can see that 84.4% reported that they were satisfied, while 15.6% were dissatisfied with the service. Then, with regard to intention to utilize the service for further delivery, we realized that we reported that 78% of the patients agreed that they would utilize the facility for future service, for future delivery, while 22% reported that they would not, they will look for as services elsewhere. Now, those that agree that, or those that reported that they would want to utilize the service or the hospital for their future delivery gave some reasons as to why they would want to use the service, use the hospital for subsequent deliveries. And most of them give the fact that they were satisfied with the current or the service at that time to be a major reason why they will return for their future deliveries. Then, of course, another group of patients, up to 90.2%, felt that if they are referred to use the service. Then patients that live close to the hospital and felt that that's a major reason why they will use the service were up to 6.6%. And 5.6% felt that since the cost, as far as they're concerned, the cost is affordable, and so they want to use the service again in future. And 2.1% of the patients felt that the drugs and supplies were available, and that was a reason why they want to utilize the service again in future. As for those that indicated that they will not want to use the service or the hospital again in future, I mentioned that they are up to 22%. And there are reasons for not using the service. Majority of the patients that reported they will not use the service are actually women that have completed their family sizes, and so will not likely come for delivery. And that was the reason why they said they would not use the service. However, up to 22.2% of the patients were actually dissatisfied with the services. And based on that, their position was that they wouldn't want to come for their subsequent delivery in the hospital. Another 16.7% felt that the cost of services were so high, and that's the reason why they would want to seek alternatives to the hospital. 11.1% of the patients felt the attitude of staff was not good enough, while 7.4% felt that the hospital was not clean enough. And then another 7.4% felt that drugs were not readily available, including consumables. Finally, another 7.4% felt that the areas of residence were quite far from the facility. Now, when we subjected the findings to further analysis, we did a comparison of patients that were satisfied and those that were dissatisfied. We found out that the demographic variables were really not statistically significant, when we compare between those that are satisfied and those that are dissatisfied, with the exception of that is the Fulani ethnicity. So we felt that the Fulani, of course, most of the patients were satisfied with the service, and there was a statistical significance between those that were satisfied and those that were satisfied when it comes to the ethnicity. And then the Fulani, of course, topped most of the patients that were in the facility, that received care in the facility. So we felt that since it was significant statistically, it suggests that the service that is available in Furati Hospital Bombay is culturally acceptable, And that's the reason why this was significant statistically. And then when we looked at the association between obstetric characteristics of postnatal women and maternal satisfaction, we found out that there was basically no statistical significance when we look at whether they were in their first pregnancies or subsequent pregnancies, whether they had one child or more than two or more children, and then mode of delivery, whether it was cesarean section they had, instrumental delivery or spontaneous vaginal delivery, and then whether they had complications. Found out that there was no statistical significance with regard to the obstetric characteristics and maternal satisfaction. So similar findings were reported in other centers. Sorry, I'm taking the discussion pari passu. And one of such centers was a study done in Nepal, where women were actually more satisfied with the interpersonal relationship and technical aspect of care than information and cleanliness. And we all know the importance of a clean health environment for healing and cure of the sick, and the fact that the dirty environment can actually predispose to hospital-acquired infections. So we found out that majority of the patients actually, 78.4% were satisfied with the services and will return for utilization. And those that did not intend to return to the facility in future were only 21.6%, amongst which 27.8% gave reasons as completed family size, and only 22.2% will not do so because of dissatisfaction. And of course, I also mentioned that satisfaction was related to ethnicity, which suggests that services are culturally and religiously acceptable to most of the women. So from here, we can infer that consistently improving on the quality of care will enhance sustained utilization of facility for childbirth services and use of skilled birth attendants, and thereby this can reduce our morbidity and mortality from childbirth. So by way of conclusion, we can say that a majority of the women were satisfied with the delivery services and will utilize the facility in future. And there's also need to sustain and further improve on the quality of service, particularly when we look at the issue of the domain of information provided. There's need for us to improve upon the information we provide to these women as regards their care, because that was the domain that had the lowest percentage. While our study may have some, definitely our study has some strengths, which include the fact that we are looking at, we use a pre-tested questionnaire to administer the study. We actually did a pre-test to check for appropriateness of the tool before we deployed the questionnaire. And then we also try to be objective and assess as many domains as possible to ensure that we look at all the areas where patients can have a perception and give a feedback on how they are being cared for. Our studies is however limited because we used researcher administered questionnaire, which meant that there can be some bias in taking the patient may actually report that they are satisfied when they are not actually satisfied, because we are still the caregiver is the same person also administering the questionnaire. But despite this shortcoming, we're optimistic that we have a very good representation of what patients actually feel about how they're being treated in the facility. Now, with regards to appraisal, of course, the CASP checklist for assessing or giving a critical appraisal for research articles may not be applied here because this is a cross-sectional study. So, but I looked up another tool that we can use to do a critical appraisal, and that is the JBI Critical Appraisal Checklist, which is the Joanna Briggs Institute for JBI Appraisal Checklist for an analytical cross-sectional study. Now we'll look at their domains. They have 8 domains. The first one is whether the criteria for inclusion in this sample was clearly defined. So we have clear-cut inclusion criteria in this study, which I've mentioned, and then the study subjects and setting whether this was described in detail, and that has been done under the methods section, where we clearly stated that these are patients that have just delivered and were yet to be discharged from the postnatal ward. Then the exposure measured in a valid and reliable way, this is not applicable to this study. And then their fourth checklist is that were objective and standard criteria used to measure the conditions, which is what I just mentioned, that we used 4 domains to look at how patients were satisfied with our study, including the facility itself, the health workers' behavior, the environment where the patient was seen, technical aspect of care, and the information provided. And these are very standard criteria that has been used in other studies. Then were confounding factors identified. We look at demographic characteristics and also the obstetric characteristics. And then the 6th checklist in this tool is that were strategies to deal with confounding factors stated clearly. We did an inferential statistic to compare 2 groups of women, those that are satisfied and those who say they were not satisfied, to look at whether there were any differences in the assessment. And we found out that with regard to satisfaction, the following ethnic group, the ethnicity has a significant outcome. But then we didn't actually look at the comparison of those that is, we didn't look at the scale of dissatisfaction to look at whether there's any significance in between the 2 groups. That's looking at dissatisfaction, as it were. The 7th item on the checklist is whether the outcomes were measured in a valid and reliable way. And like I mentioned earlier, we use the Likert scale, which is a verified way of assessing perception. And finally, was the appropriate statistical analysis used? And we mentioned that we did both descriptive and inferential statistics to assess the outcome. Then overall appraisal, I think I'll leave that to for comments when the comments come in. So I think at this point I will hand over the discussion to the Dr. Atiobi so that you can take it over from there. Thank you very much for listening.
Thank you very much for that presentation. I think it should raise some interest, because just like we had an earlier discussion before we started officially, we have hardly done, or we have rare that we have find studies that are strictly patient oriented like this in this side of the world. So this is very encouraging. Very quickly, we welcome Dr. Maina, who is also a co-coordinator for the journal club, one of my speakers and a co-author joined during the course of this presentation. So, having heard Dr. Gail's review of the article, we will now welcome questions and comments and contributions from the attendees. This can be in the form of you raising your hand so that I can allow you to speak, or you can type your questions in the chat box. Thank you once again for this.
While we're waiting for questions, I would like to welcome Dr. Zainab Malik from Pakistan. She's also OBGYN. We were supposed to take her article in September, but we were unable to find a reviewer. But we're hoping we can take the article in December. Most of her papers I have seen are also those that assess satisfaction, that have impacts, not things that aim to be big names, but things that low-hanging fruits. So you're welcome, Dr. Zainab.
Thank you.
Whilst we're waiting for questions from the audience, I have a few, should I say questions mixed with comments for the authors. I see at least 2 of them here. do you think your results are a true reflection of what we have on ground? Yes, I know we're in the days of evidence-based medicine. This is hard data, but from what you know, do you think this reflects the true situation of things? One, that's my first question. Then my second question is, this tool that you used and you said you validated, how did you validate? I know you said you pre-tested. Was it amongst the same patients who you were going to study? Or did you study in another facility, or where? Those are my first two questions before we have questions from the audience. Dr. Sagir?
Yes, the pre-test was done in the delivery suite in Federal Teaching Hospital Gombe O&G department. So it's in the same facility we did the pre-testing. And that was done to help us to make sure that the test tool was without any too many errors or any issues that will affect perception or affect assessment. So we did that in the labor ward before we deployed the tool for the study.
Sorry, just before you answer the second one, what was the interval between your pre-testing and data collection? The reason why I'm asking is, if you did it, if it was just a few days before, then there's a possibility that the patient's mind, then you're likely to sample at least a certain number of patients who were those who had participated in the revalidation to validation of the questionnaire. I don't know if you understand my question.
Yes, I get your question. The patients that were used for the pre-testing were not involved in the study. Those that we do because we have a very high turnover in O&G department. Maximum patients are discharged within 7 days, except those that have serious complications, and usually there are quite a few. So these are patients that were just delivered, the pre-testing was done, and then by the time the study was commenced, we didn't have any patient that participated in the pre-test.
Thank you. And my second question, do you think this reflects the true picture of what is going on? And as they say, be careful how you answer, because there's something coming after.
Yes, of course. Yeah, well, I've already given the caveat that while we made efforts to do objective assessment of patients' perception, we're also not mindful of the fact that since we are the researchers and we are the patients, we are the same clinicians seeing these patients. We know that there may be some bias actually. Maybe some patients may actually feel uncomfortable to actually voice out, what they feel. But then overall, we feel that at least it's something that we can say due to can have at least some reasonable degree of accuracy as regards to what exactly these patients are feeling and how they what they're actually feeling, and that we are confident of that because of the fact that we spread out patient satisfaction across those domains that we were talking about. And we looked at not only interpersonal relationship with the health worker, but also we looked at technical aspects of care and even the hospital environments. Yeah, one would expect that, okay, patients can actually, complain to the doctor that the environment is not clean enough because of the fact that they may actually feel that the doctor can do something about it, or at least inform the authorities to get those things done. So that aspect may not really be biased. Maybe when you're talking about technical aspect of care, probably patients may not want to. Some patients may shy away from telling you exactly what they feel about how you take care of them. In terms of monitoring in labor, fetal heart rate, and checking and other technical aspects of care. But when it comes to environment, facility, cleanliness, we expect that we have at least an objective assessment by patients through the study. Thank you.
Thank you.
Thank you very much. Any questions, comments? Sorry, I have one or two questions slash comments also. When in review of the ethnicities of this patient, you had Fulani Tera, I mean, for the fact that we are from this side. Is it that for your Fulani, you merged Fulani and Hausa, or you did not have any Hausa patients at all in this study? Because Fulani were most of them next to Tera, and then Yoruba, Igbo, and the other stuff. So that you merged this, it was strictly Fulani, and you didn't have any Hausa in the study at all. I don't know of what significance this may be for the fact that this work aims to make some recommendations which improve quality of care. For some of the patients that did or that were dissatisfied with care and said that they will want to look for services elsewhere, I think that your questionnaire should have added a subsection for this kind of patients. Whether their subsequent care will it be in a tertiary institution or will it be in some other form of institution? Where, I mean, if they don't come to our facility, they can still go to another facility that should be able to provide adequate care for them and still prevent maternal and child mortality. For the fact that part of your domain also included something that had to do with teaching breastfeeding, assessing patients, mother's health, baby's health, I think that perhaps one pediatrician should have been added as one of the authors of this study. And then on page 10, under your discussion, I barely my notes, but I did find a grammatical error. That there was a section, I didn't write it, but it was on line 14, second paragraph. Instead of May, when the authors were talking about doctors leaving the country and things like that, instead of May, I think the A was omitted, so it was Y. It was mine that was added there. And also, in the beginning of the article, I think this was during the abstract. But the fact that the authors were like 5 or 6, but there was a statement in the beginning part that was first person. I collected or something along that line. I can't remember what it was on the first page. I think, I mean, it's almost as if only one person that's person that's important. So I don't know, maybe we should have been what should have been given rather than I. And then I also think that during the course of the presentation, rather than just giving us percentages, it would have been good if we had the number, the percentage, those are numbers, but if we had the number of patients, percentage, 40%, which was at 20%. So that compared to we have an idea of the number of patients that was satisfied or dissatisfied as this would be under the various domains. And thank you very much. Look at that. Thank you.
Hello, can you
Yeah, we can hear you.
Yes.
Noise.
Your second question about facility, using facility elsewhere.
Yes. Yeah, I said
the second question about the facility elsewhere. The second comment you made.
I said yes. I thought under the patients that were dissatisfied, one of their reasons was one of the patients that were dissatisfied was one of the things that why did or that will not want to come back. Sorry, one of the patients that did not want to come back was that they want to look for services elsewhere. So I now say that a subsection should have been added to that any question. I mean, if okay. Hello?
Sorry, I can't hear you very well, but the patients that if I will respond, can you hear me?
I can hear you.
Yes, those patients that we will not want to use the facility in future. The reasons that they gave were either they had completed family size, or whether they were dissatisfied with the service, or whether the cost was high and they felt they couldn't afford it, or the staff were of very, as far as they're concerned, had poor attitude, and the issue of cleanliness, and then drug availability, and then distance from their residence. These were the reasons. Yes.
Yes. So what I was talking about was that for these patients that will not want to use the facility subsequently, maybe there's more of a suggestion as an afterthought, more like that perhaps it would have been possible for one to inquire if their subsequent care will be in a tertiary facility or a non-tertiary facility. Because as I said, this is your study. I mean, if all things being equal, if they can improve health.
Okay.
Yeah, so that's what I'm saying. Like if something like that could have been provided, so that
Okay.
we know that, I mean, because this study is not just where it is assessing care in this facility. It's also good to know holistically patients' perception outside FTH domain. Where will they want to go to get their subsequent care? Vis-a-vis preventing maternal and child. So the aim of why we want to know patients satisfaction if they will come back to a tertiary facility. So I just said that more like a suggestion.
Okay, yeah, I understand. Just for us to have an idea of more details on where they would like to go to subsequently if they're not coming back to the facility. Yes, I get you. The other comments you made are well taken. The issue of authorship, it's good to collaborate with the pediatricians, is well noted. And then the statement I is also well noted. Then, though I didn't include it in the slides, but in the paper we have the numbers there. So sorry about not including it in the slides. And then, sorry, the comment you made on page 10, you were breaking at some point. I didn't really get it.
No, I said it was there was a grammatical error on page 10.
Okay.
Yes, second paragraph. I think there was something on. It's imperative to note, going by the current reality in Nigeria, many also have lived in the country. You know, the narrative, even in the study facility, might soon change instead of may soon change. So the A was
Okay.
omitted. Yes, it was just
Okay. Yes. Thank you so much. Thank you. All right. Then your question about the Fulani is actually supposed to be Fulani Hausa Fulani, but I agree with you. We needed to have separated the two. Thank you so much for your comment.
comment.
I'm still on this because of my interest and previous work on quality improvement, patient safety. And of course we have an idea what maternal mortality rates are in Nigeria, as you have rightly alluded to in the paper. And we know that the picture in our facility isn't exactly the best. So if we're churning out good figures like this, for me, I think there's a disconnect somewhere, because we had done a general patient satisfaction survey before, where we surveyed close to 2,000 staff and then users of the facilities. And honestly, the result was abysmal. And I'm doubting if much has changed, because we have an idea how difficult it is to be able to put into practice, to be able to change the culture, especially when there's no motivation. When I mean motivation, is there government-backed policy to support a policy on quality improvement? Is there I don't want to use the word incentive, because in Nigeria, when we say incentive, we tend to think of financial incentives. But at the time when we're doing the project, one of the people from the UK said one of the things that you can get if you've done a project that has measure that has measurably improved quality improvement, patient safety, you can get like maybe 2 days added to your annual leave and things like that. So it doesn't have to be monetary. So my submission is, I think there's a disconnect somewhere, because if we're getting good figures like this, it means, oh, we can go to bed and sleep. And you and I know we're very far from that. So I'd really like you to make a comment on that. I understand you had talked about the biases and things, but do you think that there's a disconnect between what you're feeling on ground and what results you're getting?
Yes, thank you very much for your question. I think your question is a very, very good question. And I'll respond to it like this. First, the fact that, in our own study, we're only looking at, because what you mentioned just now is about the facility as a whole. But in this study, we're just looking at women that have delivered in the facility. And remember that in our exclusion criteria, we excluded women that were mentally unstable and who had serious complications, who were severely ill. So we're basically looking at patients that had, if more or less, for those that had vaginal delivery, we can say they had a physiological process. And we all know how it is when you have a newborn. People are very generally happy, they're in high spirits. And so for us to really look at our services as a whole, going through all the departments in the hospital, we need to do a more expanded, study to look at not just delivery, but to look at other services as well, other clinical departments as well, and to look at what patients are going through. I think that we may be having such very good figures here, because of the fact that we excluded those that were severely ill, because of course we don't expect those who are severely ill to, to be subjected to such study, to be given their perception, when really should be more or less concerned about how their safety and how you can get them out of that critical time. And of course, we cannot wait for them to get better and then do the study, because we want to assess the service as soon as delivery has occurred, before discharge. So that's why we excluded them. So that's probably what can explain the fact that in our own study we have good indices. So I think maybe you can look at possibility of doing other studies, we can expand this to other departments as well, and that will help us to look at services, as a whole in the facility. Thank you.
I love your politically correct submission, but point noted. Thank you.
I was just about to say
that. Thank you so much. Thank you.
I didn't realize it was a political answer until you said so.
It was very nicely. All right. I don't see any comments on the chat. I also don't see any hands raised from those.
I want to add one thing.
Okay, thank you.
Please go ahead.
Go ahead.
Yes, can you hear me?
Yes, clearly.
So, in my undergraduate level, when I was doing my MBBS, this was the topic of our community medicine research thesis, that mother satisfaction with delivery services at our tertiary care hospital in Bahawal Victoria Hospital. And I was appointed as to collect data of different patients having normal delivery and C-section, how much they are being satisfied with the services and with the neat and cleanliness, and the same questions. And I was astonished at that time that most of the patients, at the top, we were having the complaint of attitude and behavior problems of the staff nurses and doctors. And at the second topmost complaint was the cleanliness. As in tertiary care center, there was rush of patients. Our sweepers and janitorists to mop the surfaces and to clean the environment. So it is far more behind 20 years ago when I collected that data. And the same situation is in Pakistan in government hospitals, that due to I think due to overcrowding and more number of patients and less number of staff, especially staff, nurses and janitorial staff. So there is always a complaint of issues and cleanliness. So I think the most important thing that improve quality is of services in the form of doctors and staff nurses and janitorial staff should be present to improve our services. We must demand more people to give good services, I think.
Thank you.
Thank you very much. Valid point. Okay. Thank you.
So I think we agree that this is a very important topic, especially for developed countries where quite a number of the facilities, don't let me say most, are government-run facilities. And we know how government-run facilities are in most places in the developing world. Whether you do the work or not, you get paid. So generally, attitude is less than desirable. And because they're relatively cheaper than other institutions, there tends to be overcrowding, they tend to be understaffed. So we tend to have the same problems. Thank you so much, everybody. Thank you. I'll hand over to the coordinator now, Dr. Toby. Thank you.
Thank you very much. We've come to the end of the presentation for today. So we want to thank Dr. Segir once again and the other authors that were present initially from gynecologist federal treatment. So thank you very much for attending to this program. We will meet again sometime next month. Thank you all.
Thank you, everybody. Thank you.
Thank you. Bye-bye.